just... Okay, hopefully you can all see the screen now. Let me know if you can't see the screen. Just put it in the chat. Right, I'm assuming that's everyone can see the screen, so we shall make a start.
Great.
So,
thank you for asking me to speak. When I was asked to give this talk, I thought I'd concentrate more on what I would tell my 16, 17-year-old self, looking back on what I've done so far. What advice would I give that person so they can make an informed decision? I think hopefully that will be useful for the people that have come tonight. Next slide, please. So my pathway has been quite standard, I think. So I left school in 2001. I went to Edinburgh Medical School, graduated in 2006. Most medical schools are between 5 and 6 years in length. I did my foundation year jobs in Yorkshire. I spent them in Leeds and Halifax. I then did another year in Sheffield. I then, in medicine, I then got my ophthalmology training in Edinburgh, which took 7 years between 2009 and 2016. And then the further year of retinal surgery fellowship in 16-17, becoming consultant in 2017. So you can see from leaving school in 2001 to becoming a consultant in 2017, it's about 16 years, and that's not without that much faff. So the only year that you could really cut out of there was the year of medicine. So it's about 16 years from leaving school to becoming a consultant, and that's pretty streamlined for a hospital progression. Next slide, please. So why would I say you should do medicine? Personally, for me, hands down, it is the best career in the world. Ultimately, at the end of the day, you want to be happy and you want to have job satisfaction, whatever career you choose. And every career has its own pros and its own disadvantages. In some careers, you have good hours. In some careers, you have good pay and good other things. But in medicine, hands down, it is easily the best career in the world. If you can imagine making £1 million on the stock market, and you can compare that to saving someone's life, there's no amount of money that is even comparable. It's just, if you keep that as a mantra in your mind, then sometimes the negatives just pale into insignificance. But for me, there's just no career that is even comparable. And one thing that was always said to me when I was younger was job security. And I never really picked up on that. But actually, in the current climate, it's really important. We see lots of difficulties in different professions. But when times are good, you need doctors. When times are bad, you need doctors. So generally speaking, whatever time it's in, yeah, the profession might change in terms of what we do and how we do it, but you'll always need doctors. And so in terms of job security for the rest of your career, in general, it's a very secure profession. Remuneration, we tend to get remunerated very well, which means that we don't have to worry from that side of things. And these are important things to take into consideration. You know, having a stable financial footing is important as you get older in life, when you need to have commitments in terms of other financial commitments. Having a secure job which pays you well, these are important considerations. But one of the best things that I find is teamworking. No doctor works on their own. You have such a big team that you have to work with on a day-to-day basis, and you have to work well with them. If you don't work well with them, then you can't do your job properly. And it's very cliched, you know, you go into medicine to help people. But at the end of the day, that is what we do. And that is what makes you happy. There's a reason that if you help an old person cross the street,
best job in the world.
There's a reason that you feel happy with that. And in helping people, you do genuinely get a buzz out of it. Whether that's you treat someone's cataract like I do on every week, or if you treat someone's painful condition, you're helping them get back to functioning. That's really important. In lots of different aspects of medicine, you can work abroad, both if you wanted to move abroad in terms of have that option open to you. If you wanted to work in a different country, that's there, but also lots of charity work available. Lots of parts of the world have very poor healthcare coverage, and being able to do that charity work is available to many doctors. In my profession, I've had the opportunity to go to Trinidad and Tobago, and there's other parts of the world that I've had the opportunity to go to, which I'm currently pursuing. But unfortunately, it's not all a bed of roses. Next slide, please. I think one of the things that I would have said as a negative is certainly the stress. Medicine does carry with it a significant amount of stress. We don't tend to remember the cases that do well, even though the vast majority of our cases do well. We always remember the one that could have done something different there. Could that have gone better if I did something a little bit differently? And those things stay with you. You don't get to shy away from them. You know, if you make a mistake in other professions, you can sort of try and fix it. But when you have to look a patient in the eye saying, you know, you had a complication there, that's not easy to do. And it's not easy for the patient to hear. But sometimes you have to take that on the chin and say, we do an amazing job, and not everything is treatable. And being able to deal with that is an important thing to be able to cope with. If you can't deal with stress, then I don't think medicine is necessarily for you, because when we leave our patients in the hospital, but that baggage still comes with us home. You know, sometimes we're up at night thinking about these patients, and that's hard. You have long training, as you could see from my pathway, it's 16 years. So you don't really fully settle down until you become a consultant. So for me, that was 16 years, and I'd said that was relatively streamlined. Sometimes if you do research or have maternity leave or anything like that, you can add extra 2, 3, 4, 5 years comfortably onto it. And then you're not settling down until you're into your late 30s, 40. As I'm sure you can imagine, that can be quite difficult from a family life. You have long and unsocial hours, which again are impactful, and they can continue even into your consultant life if you do a specialty which needs overnight cover. Things like A&E, obs and gynae need to be in the hospital overnight. Sometimes you can't choose exactly where you're going to be, and you might want to stay in a particular location, but if you have to move to a different area to get the specialist training number that you want, it's difficult to stay in that place. And it's not all clinical. To be honest, I'd love to be just doing clinical things day in, day out and just seeing patients. That's great. But unfortunately, as you become more senior in medicine, you take on other roles and other responsibilities, because that's just part and parcel of what you do. So sometimes you can have a teaching role, sometimes you can have a role with management, sometimes you can have a role with research, and that takes up a lot of your weekly time. In a typical week for me, if you divide the week into 10 sessions, morning and afternoon each of the days, I typically do between 2 to 4 theatre sessions, between 3 and 4 clinics, and then another couple of sessions of private practice. And you can see that all that added up is actually quite a lot of patients that I would see on a weekly basis. Next slide, please. So what would you do next? I always say that one of the best 2 weeks of my life was one of the worst. And that was when I was 16 years old. I spent 2 weeks in an accountant's firm, and I sat behind a desk for 2 weeks, and I absolutely hated it. But that told me I didn't want to be an accountant. And that suits other people, but it didn't suit me. So if you are thinking about a career in medicine, the best thing to do is to see what it's like, because that's the only way you're going to find out if you genuinely like it or not. And do what you're doing today. Speak to people in the profession, and they will help give you that insight. And the other thing is, if you want to do it, don't let anyone put you off. You need to be determined. You need to pursue it. You need to try harder. And when you get a knockback, then just say, I'm going to make myself better, and really push yourself for it. But similarly, you might find out it's not for you. Maybe for some of the reasons I said, maybe for some of your own reasons. But there are other careers that you can consider that are in the medical profession, but not necessarily medicine. So we can't do our jobs unless these other professions do their jobs as well. And a lot of ophthalmology, which is what I'm an eye doctor, but a lot of eye care is given out to optometrists. So they do a lot of primary eye care now. That's eye care in the community, and checking for stable conditions. They monitor a lot of conditions in the community, but also physiotherapy, occupational therapy, nursing, radiography. We need these professions to be able to do our job. And sometimes that's what suits other people more. So with that, I'm going to finish. I think my 10 minutes is up, and I'll pass on to Dr. Hussain.